So psychosis is a type of mental illness, and there can be lots of different causes of psychosis. Essentially, it's difficulty with reality testing. So the person suffering from a psychotic episode has a different reality to the rest of us. And that there can be lots of different symptoms of psychosis. A common symptom you may have heard of is something called a delusion. So a delusion is a very fixed, false belief that is not in keeping with cultural norms. So that could be something very bizarre, like, I suppose, aliens interfering with your life, or it could be something less bizarre, like a gang or something like that following you. There's other common symptoms of psychosis that people may have heard of are something called hallucinations. We usually think of auditory hallucinations, so hearing things that aren't there. That can be like hearing people talking about you or directly to you, or it could be hearing noises or other sounds that aren't there. And then hallucinations can actually happen in any of the senses. So some people see things that aren't there, some people might smell things or taste things that aren't there. So they can be quite a diverse range of experiences. And then the other common symptom of psychosis is something called passivity, where the person feels that there's an external body essentially controlling their movements, their mind, or what they're thinking. One of the common signs that we see of psychosis is something called thought disorder, and that's essentially the person's ability to structure their thoughts. And what you will notice is that it might be hard to follow what the person is saying, that they might be veering off track, or adding very unnecessary detail about a certain topic, and essentially just that they're very hard to follow. It's difficult to have a coherent conversation with them. Voice hearing is quite a complex concept, but lots of children will hear voices or have unusual auditory experiences, particularly in middle childhood, so around the age of 10. Usually these go away as the person becomes an adolescent, but I suppose some people with a history of trauma or emotional difficulties will also hear voices. Usually they're able to identify them as being part of themselves, so they will say that they're kind of a projection of their own thoughts or their own experiences. True psychotic voices or experiences will usually be outside of the person, so the person won't say that they're within themselves. They will say they're within the environment around them, and there's usually an external cause causing them. So but yeah, hearing voices at an earlier stage in your life does increase your risk of developing psychosis. So schizophrenia is a type of mental illness where the person essentially has a lower threshold or essentially higher chance of becoming psychotic. So it can they usually experience a range of different psychotic episodes throughout their lives. The causes for psychosis that could affect any of us, so for example, drug use, sleep deprivation, high stress states, will still affect somebody with schizophrenia, but they will be more likely to provoke a psychotic episode. And typically somebody with schizophrenia can expect, if they come off their medication, that they will have something called a relapse, or that their psychotic symptoms will come back in a very strong way, and they may need acute treatment, so to see their community mental health team more regularly, or attend a kind of more structured, say, day hospital setting, or even need an inpatient admission. I think one of the things to remember about schizophrenia is that although it's essentially a relapsing remitting illness, so people get better and then may relapse or get worse at time and have acute episodes, it can, it certainly can be a very manageable illness, and there are lots of different strategies that we use to treat it, including medication, and it, most people, if they're compliant with their medication and engage well with their team, and address maybe some of the other stressors in their lives, they can their functioning can be very good, and that they can avoid their risk of becoming unwell. So, the difference between a psychosis and a psychopath essentially is that psychosis is a mental illness that is usually episodic, so it comes on acutely and can be treated and go away, and the symptoms I've already described. A psychopath is somebody with a set of personality-based difficulties, usually a range of different traits. So that would include having some antisocial traits, some narcissistic traits, and some emotionally unstable traits. Usually these come out of lots of different causes, early childhood trauma. There's often a genetic element. But these traits are there throughout their life, and the treatment essentially is psychological, whereas the treatment for psychosis would be primarily biological, so medication and the other things that I have described. So that's the main difference. So as a psychiatrist, I very commonly see recreational drugs having a role in the development of psychosis. If you use cannabis, particularly at an earlier stage of your life, so as a teenager, your chances of developing schizophrenia increase 4 to 5-fold. So that's very high. Cannabis in particular is essentially a pro-psychotic substance. Lots of people will self-medicate with cannabis for anxiety symptoms, but not realise that actually it causes your risk of developing a mental illness to increase, a huge amount. Reducing and stopping cannabis use is probably the first thing I would say to anyone who is hoping to avoid or managing, if they're managing psychotic symptoms. The other substance that we see that can be very problematic is cocaine use. Again, that's something we would advise that people avoid, and seek other ways to cope with life and with any problems that life brings, because they can increase your risk of developing a mental illness quite a lot. Yeah, so we're seeing an increasing number of young people presenting with psychotic symptoms by using vapes, so over-the-counter substances, HHC and things like that, and that has become increasingly problematic over the last couple of years. What people don't know about these substances are that they can cause quite unpredictable forms of psychosis that can be difficult to treat. There is a perception that because you can buy them legally that they are safe, which they are absolutely not. And I suppose it's important to remember that there is legislation enacted for that covers these substances and that bans them, but unfortunately it's just not being enforced at the moment. So.